everyone, welcome to Trachs 1.0 as I'm calling it. Today I'm going to give you a very brief overview about trachs. Let's get started. So what exactly is a trach? In short, it is a type of artificial airway. There are several indications for a trach. These include prolonged intubation during the course of a critical illness, subglottic, laryngeal, and/or tracheal stenosis. Stenosis just means a narrowing. Obstruction from obesity for sleep apnea, congenital abnormality of the larynx or trachea, bilateral true vocal cord paralysis, severe neck or mouth injuries, facial trauma, inhalation of corrosive material such as smoke or steam, presence of a large foreign body that occludes the airway, paralysis of the muscles that affect swallowing, causing a danger of aspiration, and long-term unconsciousness or coma. Let's talk about the technical term. Tracheotomy is a surgery to make an opening in the trachea, called a tracheostomy. The tube that is put into the tracheostomy to keep it open is called a tracheostomy tube, aka, as we know it, a trach tube. Next, we will discuss trach placement and parts of a trach. Trachs are typically between the second and third tracheal rings. The parts of the trach include the outer flange, outer cannula, inner cannula, obturator, universal hub, and a cuff. So, generally speaking, trachs can be cuffed or cuffless. So if it's cuffed, it means it has a cuff that comes with it. And on the flip side, obviously, if it's cuffless, a cuff would not come with it. The size of trachs vary. So we have a size 8, which is typically the largest seen and typically the first size placed. We have a size 6, which is kind of a medium size. And then we have a size 4, which typically is the smallest size before trach decannulation. Trachs are downsized according to setting protocols and the patient's medical tolerance. It is important to know that a trach downsize is almost always a good thing. So let's talk about what trachs are made of. We have silicone trachs, which is the most flexible. This brand is usually Portex. We have metal, which is the most rigid. This brand is called Jackson. And we have polyvinyl, which is somewhat in between. The most common being used is Shiley. Next, we will address the several complications due to trach placement. This is not an all-inclusive list, but it does have the most common complications. So first we have loss of taste and smell. An increase in secretions because our body is treating the trach as a foreign object. We have decreased laryngeal elevation. There's increased risk for infections, primarily respiratory. Loss of verbal communication. Tracheal granulomas can occur due to abrasion. Tracheal malacia, which means floppy tracheal walls due to tissue breakdown. Tracheal stenosis can occur. As I said earlier, that's just a fancy term for narrowing. And then we can have tracheoesophageal fistulas. Trachs are typically a temporary condition, but they can have some long-term side effects. This includes tracheal stenosis. This occurs at the site of the stoma, voice disorders, and/or dysphagia. So next we will discuss some important facts about trachs and aspiration. Recent research suggests that the need for a trach predisposes an individual to aspirate. Therefore, there is a correlation between trach and dysphagia, but it is important to note that the trach is actually not the primary cause of dysphagia. Last but not least, let's talk about cuffs and put some myths to rest. Traditionally, the cuff has been thought to protect the airway from aspiration. However, the cuff is located below the area of the true vocal folds. Therefore, anything on top of the cuff has already been aspirated. So with that being said, a few take-homes. Inflated cuffs do not prevent aspiration during the swallow. They also don't prevent liquids or saliva from leaking around the cuff and into the airway. And lastly, inflated cuffs further limit laryngeal elevation and airway protection, resulting in a higher frequency of aspiration. So thank you for tuning into my little mini lecture about trachs. I hope you learned a lot. Until next time.